hello, good afternoon. Um, my topic for the day is that I'll be focusing on the ellipsoid zone in diabetic macular edema, as this is a new avenue which has been developed over the past decade, and now from our regular OCT, the things should now start and go into the ellipsoid zone. As we all know that diabetic retinopathy is sort of correlating well with the structural changes in the retina, and it provides all the layers through spectral domain optical coherence tomography. Of late, the focus has now been on the outer retinal layer, and these are the two layers which are of prime importance. I will be focusing on the second layer, which was previously known as the ISOS junction and is currently termed as the ellipsoid zone. Now, this term came from a study by Spade on a frog model, which showed that this ISOS junction correlated with the ellipsoid zone in the photoreceptor, and hence the name. In a rat model, it was found that after euthanasia, this layer tends to disappear. So this layer might be also just because of the biological activity. Now, our work has been focused for the past 10 years, and we have found that the external limiting membrane may work as the third blood retinal barrier because that layer has the tight junctions, and this layer also has a protein by the name of occludin. And as there is an increase in the serum VEGF level, there is a decrease in the occludin levels, and this leads to an increased permeability of the retinal vasculature, causing DME, as we know. And also what we found that it causes a disruption of the ELM and subsequently the ellipsoid zone disruption. So over the past decade or so, we have been able to develop and publish a couple of very good classifications, and we can grade this ellipsoid zone disruption into grade 0, 1 and 2, where there is no disruption, or in grade 1 where the ELM disrupts first and subsequently that leads to the disruption of the ellipsoid zone. So we have been able to define the pathogenesis, how the ellipsoid zone is being disrupted in cases of diabetic retinopathy. And the disruption of these layers has been found to correlate very well with the increase in loss of visual acuity. Subsequently, as the concept of center involved DME and all these things are being developed, we also focused on the Zeiss OCT, that how the whole of the macular cube goes around, and so we came out with only a classification system focused on the ellipsoid zone, and that was later published in Retinal also. And here what we found was that on a global level, we can have a disruption of the ellipsoid zone as a focal disruption as grade 1, and then as a global disruption as a grade 2. So this kind of a classification system provides a global kind of formulation that how the things are behaving as the severity of diabetic retinopathy is gradually increasing. And we found that as the disease goes from a focal to a global level, that also correlates very well with the severity of change of vision. We also found that the macular thickness correlates very well with the ellipsoid zone disruption and may serve as a biomarker. And lastly, I come to the concept that how the ellipsoid zone regenerates once we give anti-VEGF therapy. We all have been using anti-VEGF, but now once the anti-VEGF is given as seen here, things tend to improve. But lately we have been able to show that as the subsequent dosing are being given, you can easily see here that the external limiting membrane has started to restore back, but the ellipsoid zone is still in the process of restoration. So the thing we had given maybe about 10 years back, we have been able to found that with the advent of anti-VEGF therapy, the external limiting membrane tends to just get back, and subsequently that leads to the restoration of the ellipsoid zone. Thank you very much. So my basic submission now is that besides looking into those maps, we should also now focus into the cross-sectional and look into these outer retinal layers, and then focus on the ellipsoid zone, which really helps us in the prognostication of the final outcome after anti-VEGF therapy. Thank you.
Thank you, Dr. Sandeep.